Hi, my beautiful people. It is Sylvia. And this video is about my testimony regarding my eyesight. Okay. When you look at my eyes, do I appear that I have blindness in either one of them? I do. My right eye, I can barely see out of. And it's not even really seeing. It's just when I look down, if I, well, first, I close my left eye and I look down. I can see a little bit of light, very minute, like maybe about 1%. The other 99% I can't see out of. I can't wear any prescription glasses that will fix that. It is like this for the rest of my life unless the Heavenly Father has mercy on me and heals it. Okay? And I'm going to tell you my testimony from the beginning. As I explained in one of the other videos, I do have type 2, or I did have type 2 diabetes. I got to put these things in the past tense. Okay? Um, I was okay for the first couple of years into the diagnosis of type 2 diabetes. But like most of us do, we get a little lazy. We don't follow the doctor's orders and do what we're supposed to do to keep our blood sugar levels intact. Okay? And so what happened rather quickly is that I ended up being diagnosed with diabetic retinopathy. Okay. The reason why I found out is because I don't know if this is in everyone's case that has been diagnosed with it, but my eyes started hemorrhaging on the inside. There was no blood running out of my eye, you know. So, because you think that you could wipe your eye and the blood will go away, but it doesn't happen that way. It's all on the inside. And so, of course, I didn't panic. I didn't freak. I just, figured that, oh, I'll get some drops, it'll go away. No, it doesn't go away like that. You have to get the surgery, okay? Have to get the surgery. So I went to ophthalmologist surgeon, and he, like I say, he gave me the diagnosis, and then he told me what he will do. Okay, so I did the surgery. Well, I didn't do the surgery. He did the surgery, and everything was fine. The surgery was successful. Okay, I came out, a little minor pain, but not anything excruciating. Um, I don't remember wearing a patch or anything because I already had prescription eyeglasses. So that worked as my protection from like getting poked accidentally or anything like that. Okay, so we did that. That in my eye was okay. I could see, see clearly. Um, and so like it may have been a couple of days after the surgery. And all of a sudden, I had this excruciating headache. I mean, like greater than a migraine. It's like almost like gout in your brain. That's how painful it was, and I was vomiting. I don't like that term, but it is what it is. I was vomiting, and it wasn't like I vomit once and then stop. It was continuously. So I called my sister, whether she was in the house or at work, and she took me to the emergency room. I went there, and of course they give you the ophthalmologist that is on call. Okay, and it wasn't the surgeon that did the fixed the retinopathy, and This doctor came over to me and he was putting drops in. He went through a couple of bottles of eye drops. Yeah, they that much at one time. And it did not help. It didn't do anything. It didn't drop the pressure, the eye pressure. Because what happened was the eye pressure was very high. I think it was like a 37, and normal is 20 and under. Yeah, that's serious. So I don't have to say anymore who caused that. Okay, you know who attacks your body to try to unalive you. Okay, I'm not giving him no glory. He doesn't deserve any glory. Only the Heavenly Father deserves glory. Okay, because he's the one who heals you so that you can stay alive, so you could be with your family, be with your children, just be alive and live your life. Okay? So after he saw the drops weren't working, he called the surgeon. Okay? The surgeon actually got there really fast because he's in a different building, actually on a totally different street, but they're all connected. So that he came over, and as soon as he knew the symptoms, he knew immediately what it was. He knew that the pressure was too high. Okay. So he came and he did come and get me, took me over to his office. He, did some testing because, that's the procedure. And he did check the pressure. And that's how I know it was about 37. And, he did put drops in too, but they were not the same drops as the other doctor. The drops that he put in my eye, they were different. Okay, so once he did that, the pressure went down. It came down to normal, and he changed the type of drops that I was using altogether after I had the surgery. Okay, and so it worked. I was okay. I could still see and out of both eyes. Okay, look at the Heavenly Father and His mercy. Okay. And then, after that, fast forward a little bit. I had a follow-up appointment to see him, but it wasn't like immediately, because after you have a surgery like that, you're supposed to see your doctor maybe every 2 weeks, or maybe come back in a week, depending on the extent of the surgery. So whatever the time frame was, it was too long. Okay, it was too long, because after that, I started to lose sight in my right eye. Okay, and I'm like, okay, what's going on? Because I was taking the eye drops religiously. I learned my lesson when I got diagnosed with type 2 diabetes. Okay. I learned my lesson about not keeping up with the regimen and all the things that the doctor told me to do. Okay. I thank the Heavenly Father that I didn't end up in a sugar coma. Okay. But yeah, I digress. And so, I of course, again, I called him and said, Doc, this is what's going on. It's like I can't see out of my right eye. And he had me come in. came in, did tests and all that. He told me that the muscles in my eye have atrophied. Okay? Like, they don't work, basically. Now, you're saying, okay, your eye is moving. Yeah, it does move. But I have no peripheral vision in this eye at all. And I have no regular vision in this eye at all, except the 1% I told you about. Okay, that's what it did to my eye. By me not going in sooner. Not because I didn't want to, but because he scheduled me to come back later than what he was supposed to. And when he figured that out, he told me that. He admitted to it. That's what I'm saying. I could be really rich right now, sitting on multiple lawsuits, but I'm not that kind of person. That's not the type of spirit the Heavenly Father has put in me. I care about other people's lives, how they're living, how these types of actions affect them. Okay, I'm not saying don't sue, okay, because sometimes that is a way for people to get money that they need to take care of their families also. Okay? Okay. If something really happened to you that's neglect or like misdiagnosis and stuff like that, then you have the right. That's your human right to do that. But don't make false accusations and accuse someone, and because you looking like you got hit by a car with equipment around your neck and walking around a crush and rolling around in a wheelchair, and there's nothing wrong with you, because you may get some money, but it won't last, and it'll bring you a lot of pain, and then you wonder why you're not happy. Okay, just a little side note. Okay, so let me continue on. So he did admit that to me, and like I said, when I hear these things, a doctor tells me some what's considered bad news, the Heavenly Father gives me the spirit of calm. I don't go, woe is me. Why, Heavenly Father? You know, what am I going to do now? My vision is greatly impaired. I won't be able to drive, you know, or anything like that. I took solace in the fact, and he helped me, the Heavenly Father helped me to see it this way. No pun intended. He helped me to see that I still had one good eye. One good eye. I could have been blind in both. I could have been blind in both. But the Father's mercy and His grace left me with one good eye. I mean, I do wear eyeglasses. I am nearsighted. Okay? But the vision in my left eye is good. It is good. It's good enough, okay, that I could wear a pair of eyeglasses and everything is corrected. Okay? Okay. Now, after this happened, there was really nothing they could do. They were not going to go back in the eye, you know, or try to attempt something. It was nothing they could do. So, you know, I'm living with that right now. Okay? Living with that right now. So, but don't try to sneak up on me. Okay? I don't need eyes to see to know whether or not you're there. And I don't think you would want to attempt that. Okay? Because you're not going to have to deal with me. Okay? You know who you're going to have to deal with. Anyway, just a little joke. Add some humor to the sadness of the story. Okay? So that happened. And that pretty much was it. You know, I didn't have any other time where the pressure was out of control. I kept my eye appointments as much as I possibly could because my health was declining to the point where some days I just didn't feel physically able to make it, you know. And my sister, she works very long hours each day, and she would take me to my doctor's appointments. She will do that. She'll drop everything, and she will take me. Or if she can't, she will make arrangements for someone else to do that. Okay, so yeah. So, it's just got to the point where I just didn't feel like going. Now, I loved going, going shopping for new eyeglasses, you know. That was fun. That was a fun part. But going in to get the examination on the testing done, it just wasn't fun, real fun for me. I mean, the experience at the doctor's office was fun because he was a funny guy, very hilarious. Excuse me. Used to make my sister and I laugh. Excuse me, crack up. Sorry, I ate before I made the video. Um, yeah. So, but anyway, it just got to the point where I wasn't like physically capable to keep those appointments because of the diabetes and the impaired vision. Um, I had to go every 3 months, not once a year, but every 3 months. So imagine that you going to a doctor every 3 months. Okay, I had to do that for my cardiologist every 3 months. For some other doctors every month, especially the pain management. Okay, I'll get into that in another video. And I will also talk about the major illness, the heart disease. Okay? This is Sylvia coming at you with my testimony. Still the Father's message because he's been there with me through it all. From start to finish, every symptom, every diagnosis, every emergency room visit, every hospital stay. He's been there in the spiritual form, and my baby sister has been there in the physical. Okay? I speak about my sister because she's been my caretaker. She's my baby sister. I started out taking care of her when we were younger. But when we got older and I got sick, she had to take care of me. Okay? I'm getting better, sis, so that I can take that burden off of you and be your mother again. And then your child can be my grandchild because our mother is gone. Okay? I love you, sis. And I love you guys out there who watch my videos and who support me and the Heavenly Father. And who are willing to listen with an open mind, open heart, and open spirit. Okay? And not be judgmental. Okay? I appreciate that more than you could ever know. Because it's nothing but love. Nothing but love. And there are people out there who are suffering the same way that I suffered. But they don't know why. And they don't know what to do to find out information to get on alternative herbal medications and treatments. They don't have that information. And I want to reiterate because I know I said, like get on herbal remedies or do on herbal remedies. I just want to say again, Don't just stop your meds and do it on your own. Go to a doctor who will prescribe natural herbal remedies. That's the reason why a lot of them popped up recently. That's the Father in heaven's grace and mercy to his people. So you can cleanse your vessel and take in more of him and release more of you. Okay? As I was saying, good night. Be blessed. Love the Father. Love your family. Love your neighbor. And love yourself as well. Thank you very much. This is Sylvia signing out.